So far, we've looked at what we're spending today on healthcare, and we've looked at how we got to this moment. But I think it's useful to look at trends in spending over time and how we compare to other countries. So let's take a look. Health spending totaled $74.1 billion in 1970. By 2000, health expenditures reached about 1.4 trillion, and in 2019, the amount spent on healthcare more than doubled to 3.8 trillion. So why are expenses going up? We'll talk more about it, but I think it's important to recognize a couple of things. One, people are living longer. In 1965, the life expectancy for the average American was 70, and now it's 78. But beyond averages, more Americans are living into their late 80s and 90s and experiencing greater health decline because of that. Medical care has also improved since 1965. The first cardiac bypass surgery was conducted in 1960, and it's now a common surgery for Americans who have heart disease. Liver transplants weren't possible until the late 1950s, and even then with minimal success. The first heart transplant wasn't done until 1968. In 2009, over 28,000 transplants were completed. What else has improved? MRIs, CT, ultrasound, PET scans, not to mention all the blood work that can now be done. Those didn't develop till the 70s, 80s, 90s. So, and that's even before we begin to deal with advances in drug therapies, ones that are costly and yet life-saving. So our result generally is that people are living longer and spending more on healthcare. Another way to examine spending trends is to look at what share of the economy is devoted to healthcare. So again, we look at this over time. In 1970, 6.9% of GDP was spent on total healthcare spending, both public and private. And again, we saw by 2019 that has increased to 17.7%. So we really have to understand that there's been this huge expansion of this sector of our economy. That's also worth thinking about when we're talking about reforming the system, because of the number of people employed in healthcare and healthcare adjacent industries. Most of the recent health spending growth is in insurance programs, both private and public. Private insurance expenditures now represent 31.5% of total health spending, up from 20.4% in 1970. So we can see all of these changes taking place. And we also can look at the insurance spending on Medicare and Medicaid that has gone up as well. And comparing that to private insurance, you can see that private insurance, the rates have gone up higher at a faster rate than Medicare and Medicaid. So we're spending more than we have since 1970, but how do we compare to other countries? Well, as you look at this, it says on average, other wealthy countries spend about half as much per person on healthcare as the US. So we're spending almost $11,000 by this estimate on healthcare per person. And the comparable country average is $5,697. So that's a huge difference. And again, here's another way of looking at that. Where is that money going? Okay, you can see it's just hugely different of where we're spending, how much we're putting into the various parts. And this has been an expanding gap. So we really are looking at, we're going up and other nations are going up as well, but just not nearly as quickly. We're spending all this money. Are we getting better results for it? No, not so much. Because really, we look and see that we have higher mortality rates than other countries. We're spending so much more money and we're getting worse results. We have the highest rate of preventable deaths of comparable countries. Looking at this, we have a higher mortality rate for respiratory diseases. And again, let's think about this as we go and think about what's going on with coronavirus, which is a respiratory illness, among other things. So we already have, going into this pandemic, a real problem in this area. We have as well we have higher rates of mistakes being made in medicine, medication, and lab errors. So often you hear people say, well, we have this superior system, but look at all the problems that are going on in it. Maternal mortality rates in the US have also been rising. And look at this disparity between other countries. And of course, it's important to remember that the maternal mortality isn't evenly distributed among races. If you look at this per 100,000 live births, almost 41 mothers dying who are Black versus about 13 for white women. This is appalling and goes to the inequality in our healthcare system. Infant mortality, same thing. We are 71% higher than the comparable country averages of 3.4 deaths. And once again, that disparity is not even across races. This is a huge issue. And if we are going to be talking about healthcare in this country, we must deal with inequality, and the root of that being racism. Other than racism, why do we have the kinds of differences that we have? Partly, we spend money in the wrong places. We put money into expensive treatments when someone is already sick, and very little money into preventative treatments, annual physicals, screenings, vaccines, giving information and support for exercise and diet. Now, the Affordable Care Act actually tried to address this, but there's not enough evidence really to show if it was effective. Most people got coverage, so expenditures, or more people got coverage, so expenditures went up. Additionally, many of those people who were brought into the healthcare market hadn't had it before, and so they had higher costs associated with it. They had poorer health. We are spending it as well in that last year of life. So we're spending this money at the end of life with diminishing returns in the quality of life. So 30% of Medicare's annual budget goes to care for patients in their final year. We spend thousands on procedures that may extend life by days or weeks, or on procedures that have 1 in 1,000 chance of working. Sometimes those risks seem worth it, an 18-year-old in a motorcycle accident, but we have to grapple with whether it makes sense to perform these kinds of very expensive procedures on people in their 80s and 90s. And again, these are really complicated and difficult conversations to have. And they're especially complicated because we don't like to talk about death in the US. We don't have a cultural acceptance of it the way other cultures do, which makes discussions on the policy level difficult. So these are things we need to think about. We spend a lot of money on different diseases and areas. We spend a lot on diabetes, heart conditions, low back pain. We can really see here that we're spending a great deal on these chronic illnesses, and we may not really be talking about where they're coming from. So in the next video, we're going to be exploring the particular ways that American culture affects how we approach healthcare.